Picture this. You're cruising through your day, maybe sipping on coffee, scrolling through the latest memes, and suddenly your head feels like a bowling ball. Well, my friend, it could be more than the Monday blues. Your blood might be getting a little too thick. Now, before you hit the panic button, let's dive deep into the symptoms and causes of hyperviscosity, a fancy word for thick blood, and find out what your body might be trying to tell you. And don't worry, we'll throw in a few jokes along the way to keep things light, unlike your blood. The ultimate headache, not just stress. You know that throbbing headache you've been blaming on your boss or the kids? It could be a symptom of hyperviscosity. When your blood gets thicker than oatmeal, it struggles to circulate properly, leading to reduced blood flow to the brain. This can trigger pounding headaches, the kind that makes you wonder if you've turned into a human barometer. This isn't your run-of-the-mill headache either. It's persistent, intense, and might come with a side of dizziness or confusion. The headaches occur because your blood has become sluggish, creating a bottleneck effect in the circulatory system. If this happens frequently, it's time to seek medical advice because your blood vessels might just be waving the white flag. Feeling winded after climbing 3 steps, shortness of breath. Sure, you might tell yourself it's because you skipped the gym this week or month, but when your blood is too thick, it becomes harder for oxygen to reach your muscles and organs. This can make even a short walk to the fridge feel like you've run a marathon. If you're gasping for air without any real reason, it could be a sign that your blood is struggling to keep up. Normally, oxygen is delivered effortlessly by red blood cells, but when the blood thickens, this process is compromised, leading to shortness of breath, particularly during mild exertion. What's more, thick blood increases your risk of clot formation. These clots can lead to life-threatening conditions like pulmonary embolism, where a clot travels to the lungs, blocking blood flow. A pulmonary embolism can cause sudden, unexplained shortness of breath, and it's often accompanied by chest pain and a sense of impending doom. Even without a clot, the sheer viscosity of the blood makes circulation inefficient, starving tissues of oxygen. So if you're out of breath after simple tasks, it may be more than just being out of shape. Your blood might need a tune-up. Chest pain. It's not always love. Cue the dramatic soap opera music. Chest pain is a sign that could mean your blood has turned into a clot-producing factory. Thick blood can increase your risk of forming clots, which can lead to serious conditions like deep vein thrombosis or pulmonary embolism. A clot in your lung. If you feel chest pain along with shortness of breath, especially if it's persistent, it's time to stop Googling symptoms and call a doctor. Chest pain associated with hyperviscosity syndrome often feels like tightness or pressure, similar to what people describe during a heart attack. However, this pain can also radiate to your arms, back, or neck, and worsen when you take deep breaths. The reason is that thick blood doesn't flow as easily through narrowed or clogged arteries, causing the heart to work overtime. It's like driving on a highway during peak rush hour. The strain on the vehicle, your heart, eventually becomes too much, and accidents, clots, are bound to happen. The mystery of purple limbs. What's happening? When your arms or legs look like they've been auditioning for a role in Avatar, it's time to raise an eyebrow. Thick blood can cause poor circulation, which leads to swelling, a reddish or purplish tint, and a feeling of heaviness. Imagine your body trying to push peanut butter through a straw. That's what's happening when your blood gets too thick. This condition, known as cyanosis, occurs when oxygen levels are critically low in the tissues, often a direct result of sluggish blood flow. You may also experience cold extremities due to inadequate blood supply. Over time, the lack of oxygen can lead to tissue damage, and if untreated, may even result in ulcers or gangrene. In serious cases, this discoloration could be a warning sign of an impending blood clot, which can become life-threatening if it travels to the lungs, heart, or brain. Vision issues. Why does everything look hazy? You're not going crazy. When your blood thickens, it can affect your vision. This happens because your eyes, just like your brain, rely on a steady blood supply to function properly. When that supply gets sluggish, your vision might become blurred, or you could even experience temporary blindness. In some cases, People describe their vision going in and out of focus, almost as if a veil has been pulled over their eyes. The reason behind this symptom lies in the blood vessels of the retina, the part of the eye responsible for processing visual information. Thick blood can cause these tiny vessels to become clogged, restricting blood flow and causing visual disturbances. Over time, if left unchecked, it may even lead to permanent damage in the form of retinal vein occlusion, a condition where the blood vessels in the retina are blocked. So if you're squinting more than usual or can't read those Instagram captions, it's worth getting checked out. Nosebleeds and bleeding thumbs, your body's red flags. If you've been getting nosebleeds or bleeding thumbs like you're in a vampire movie, thick blood might be to blame. Odd, right? But hyperviscosity can lead to irregular bleeding. So if you start seeing blood where it doesn't belong, don't just brush it off, unless, of course, you're brushing your teeth. This kind of spontaneous bleeding happens because thick blood strains the smaller blood vessels in your body, particularly those in delicate areas like the nose and gums. Over time, the increased pressure can cause these vessels to rupture, leading to unexpected bleeding episodes. It's like your body springing leaks under too much internal pressure. While a nosebleed here or there might not seem like a big deal, if it's happening regularly, it's a sign that something's going on beneath the surface. Tingling hands and feet, not just from sitting cross-legged. You know that weird tingling sensation you get when your foot falls asleep? Well, thick blood can give you that feeling, minus the awkward leg crossing. It's because your extremities aren't getting the blood flow they need, leading to a pins and needles sensation. If this happens frequently, it could be more than just bad posture. The lack of adequate blood flow to the hands and feet can cause nerve damage over time. This tingling, also known as paresthesia, can become more pronounced as the blood thickens, making it harder for the body to maintain proper circulation. If you find yourself constantly shaking your hands and feet to wake them up, it's worth considering a visit to your doctor to check for circulation issues. Long-term, untreated hyperviscosity can lead to more permanent nerve damage, so catching it early is crucial. Confusion or dizziness. Wait, what did I come in here for? No, you're not losing your mind, at least not entirely. When your blood thickens, it can cause confusion and dizziness, especially if your brain isn't getting enough oxygen. If you've been walking into rooms and forgetting why you're there more than usual, it might be time to think about what's going on inside your veins. This mental fog occurs because your brain is starved of the oxygen and nutrients it needs to function properly. Without enough oxygen, cognitive functions slow down, leading to moments of confusion, poor concentration, and even memory lapses. While everyone has their forgetful moments, persistent confusion is a red flag. Prolonged lack of oxygen to the brain can cause permanent damage, so this symptom should never be ignored. Thanks for sticking with me through the wild ride of thick blood. If you found this video helpful, don't forget to hit that like button and subscribe to our channel for more health tips that keep it both informative. Keep your blood flowing smoothly, and we'll see you in the next video.